Hello, my name is Gabe Howard with PsychCentral.com, and we are here today to discuss bipolar disorder. Bipolar disorder, which is previously known as manic depression, is a mental disorder that is characterized by constantly changing moods between depression and mania. The mood swings are significant, and the experiences of the highs of mania and the lows of depression are usually very extreme. The new mood can last anywhere from a few days to a few weeks or even months or years. The mood swings are usually experienced very intensely by a person living with this condition. As someone living with bipolar disorder, I've often found this description to be a bit lacking. While it is certainly true that someone with bipolar disorder will experience both depression and mania, they will also experience all the moods in between. In other words, a person with bipolar disorder will travel back and forth on a spectrum that is much wider than the average person's and often uncontrollably. However, it is very possible to spend a significant amount of time in the typical range and therefore appear to be symptom-free. In order to be diagnosed with bipolar disorder, a person needs to experience both depression and mania. Common symptoms during a manic phase may include heightened sense of self-importance, exaggerated positive outlook, significantly decreased need for sleep, poor appetite and weight loss, racing speech, flight of ideas or impulsiveness, ideas that move quickly from one subject to the next, poor concentration or be easily distracted, increased activity level, excessive involvement in pleasurable activities, for example, hypersexuality, poor financial choices, overspending, rash spending sprees, excessive irritability, and aggressive behavior. You don't need to have all of those, and that list is certainly not comprehensive, but those are some common signs of mania. Common symptoms during a depressive phase may include feelings of sadness or hopelessness, loss of interest in pleasurable or usual activities, a difficulty sleeping, early morning awakening, loss of energy and constant lethargy, a sense of guilt or low self-esteem, difficulty concentrating, negative thoughts about the future, significant weight gain or loss, and of course talk of suicide or death. Not everyone is going to experience all of these symptoms, and only a mental health professional can make a formal diagnosis. But if a lot of these symptoms resonate with you or sound like somebody you know, it could be a sign that you or they are suffering from bipolar disorder. Please visit the bipolar community on PsychCentral.com to learn more. My name is Gabe Howard, and thanks for tuning in.